Welcome to Lime Memorial Surgical Services. My name is Dr. Ankit Patel. I'm an anesthesiologist and the medical director of the ERAS program. Your surgeon has referred you for an appointment with the preoperative clinic before your upcoming surgery or outpatient procedure. The preoperative clinic at Lime Memorial utilizes the techniques of the Enhanced Recovery After Surgery program, or ERAS, to identify ways in which we can improve your health before surgery and make your recovery easier and faster. We utilize best practice methods to decrease readmissions, length of stay, and surgical complications. Our patients report feeling better and having better outcomes. We will be working with you to prepare your body and mind for all phases of your surgical journey. This video will review education on all the key elements of our ERAS program, which will then be customized to your needs by the preoperative clinic. It is important to pay attention to this entire video to ensure your best success. Together, we will make a plan aimed at optimizing your recovery while considering your current health status, the type of anesthesia, and the type of surgery you will be receiving. During your appointment, you will receive a Lime Memorial Surgical Services tote, which will contain all the tools you need to prepare yourself for your upcoming surgery. This tote contains items that were custom selected for you. We will explain each tool in detail and make sure you feel confident to follow your instructions. We know that having surgery can sometimes be overwhelming. We want you to know that at Lime Memorial Surgical Services, we will be with you every step of the way. Now, let's get started and talk about the first step in your journey.
I'm Casey Herod, a nurse practitioner in the preoperative clinic. Let's talk about the first step in your journey: good nutrition. Nutrition is a key player in your surgical success, helping you heal quicker and protect against infection. We recommend that you choose a well-balanced diet, which includes fruits and vegetables, and foods that are whole grain, low fat, and high in protein. Make sure that you are drinking enough water and decrease your caffeinated and sugary drinks. Once you are out of surgery and beginning the work of recovery, slowly increase your diet back to normal, focusing on high protein. Be sure to follow your surgeon's instructions of any dietary restrictions. It is important not to skip meals, and if you cannot eat enough, try a protein drink. During your preoperative appointment, you may be given a supplemental drink to help with nutrition. We will provide you with a checklist to help you track your supplements. On the morning of surgery, you may be able to safely drink clear liquids up to 3 hours before your surgery. This has many benefits, including keeping you hydrated and preventing nausea after surgery. Acceptable clear liquids include water, black coffee, and sugar-free sports drinks or juice. This will be reviewed with you during your appointment. Sometimes after surgery, it can take some time to get your bowels moving again. We recommend that you chew a piece of gum or take a mint every 4 hours in the early days after surgery. This will help you wake up your intestinal tract and improve your appetite. When preparing for surgery, it is important to have very good control of your blood sugar. Patients who have too low or too high blood sugars are at an increased risk for complications, which makes it difficult to heal and recover. During your preoperative clinic appointment, you will receive instructions from your provider to help you control your blood sugar before and after surgery. Please follow these instructions carefully. There are important things you can do to prevent infection after surgery, such as quitting smoking and controlling your diabetes. At your preoperative appointment, you will receive 2 bottles of surgical scrub soap. You will shower with 1 entire bottle the night before surgery and 1 entire bottle on the morning of surgery. You should wash your entire body, avoiding your face, eyes, and genital area. Take special care to wash the area on and around your surgical site. We also ask that you brush your teeth before surgery, sleep on clean sheets, and do not allow your pets to sleep with you right before surgery or during your recovery. After surgery, your surgeon will give you additional instructions about how to care for your wounds. During surgery, you may be asleep, but your body is working very hard. We compare it to running a marathon. Marathon runners prepare for the race by building up their exercise tolerance. Keeping active before your surgery will give you the strength and energy you need to be up and moving after your procedure. We recommend that you maintain your normal activity level and increase it as you can tolerate. If you feel any discomfort or pain during activity, be sure to discuss this with a member of your healthcare team. At your appointment, you will receive a pedometer. We recommend that you wear this to count your steps so that you know how many steps you were taking before your surgery. This will help you understand how you are progressing with your recovery after surgery.
I'm Kimberly Kaufman, RN and Clinical Manager. Let's talk about how to prepare your lungs for surgery. An incentive spirometer, or breathing exerciser, is a device that helps improve the strength of your lungs. We recommend using the incentive spirometer beginning 1 week or more prior to your surgery to prevent pneumonia and other breathing complications after surgery. Let's show you how to use the incentive spirometer. The first step is to hold the spirometer upright in front of you while sitting or standing up straight. To start, breathe out normally, then close your lips tightly around the mouthpiece. Make sure that you do not block the mouthpiece with your tongue. The final step is to breathe in. You will take a slow, deep breath through your mouth, breathing as deeply into your lungs as you can. As you breathe in, the piston inside the large chamber will move up. Try to move the piston as high up as you can, or at the level that the provider has recommended. When you cannot breathe in anymore, hold your breath for 2 to 5 seconds. Try to keep the moving circle in the area indicated. You should try using your incentive spirometer in 3 to 4 sessions throughout the day, or even more if possible. You will need to take 10 consecutive breaths each session. If you start to feel dizzy or lightheaded, we do recommend that you stop and try again later. After surgery, you should perform a session every hour while awake until you are back to your normal activity level. Next, we are going to talk about smoking or vaping tobacco and how it affects your surgical risk. Smoking can impact your healing ability, affect your breathing, and increase your risk for infection. We strongly recommend quitting smoking as soon as possible before your surgery. Quitting can improve your overall long-term health and help you recover better. If you need help to quit smoking before your surgery, please make sure that you talk to a member of your healthcare team today. We are here to support you in any way. If you have obstructive sleep apnea, you should use your CPAP or BiPAP machine daily. We recommend that you bring your CPAP or BiPAP machine with you when you arrive for surgery. This is very important to ensure we have all of the right tools to care for you before and after your surgery.
My name is Mallory. I'm a registered nurse in the preoperative clinic. It is extremely important to understand what medications you can and cannot take in the days surrounding your surgery. Please bring a list of your medications, vitamins, and supplements with you to your preoperative appointment. The provider will review your list and offer specific instructions about how to take your medications before surgery. You will also be given a pill container to help keep your medications organized. After surgery, you will receive further instructions on how to manage your medications. Please follow these instructions very closely. Depending on the type of surgery you have, you will experience varying degrees of discomfort during your recovery. At Lima Memorial Surgical Services, it is important to us to do everything we can to help minimize your pain. Your surgeon may prescribe narcotics or prescription pain medications to help with your pain after surgery. It is important to follow the instructions provided to you on how to safely take these medications, as they may be addictive and cause other side effects. To decrease these risks, take your pain medications only as prescribed. Do not drive while taking these medications, and you may also need to take a stool softener to prevent constipation. In order to minimize the amount of narcotics you require after surgery, we may also offer you alternatives to reduce your pain. These options may include other types of medications and nerve blocks. Another side effect some patients may experience after surgery is nausea. We will utilize methods to help prevent nausea and treat it if it occurs. You may have a medication patch applied behind your ear or receive medications through your IV during your surgical stay. It is important you communicate any symptoms of pain or nausea to your healthcare team right away. Please be sure to report any past or current drug use and the overuse of alcohol and prescription medications. This can greatly impact the way anesthesia and pain medications affect you. We want to be sure to keep you as safe and as comfortable as possible.
Today we discussed nutrition, smoking, medications, and ways to strengthen your lungs and body. We hope that you found this instructional video helpful. It is important to follow the instructions you've been given, but don't worry, much of this information will be reviewed again with you during your preoperative appointment. You will also receive written instructions and checklists to refer to at home. You can rewatch this video at any time on Lima Memorial's preoperative clinic website.
After your appointment, your patient plan will be available for your primary care doctor, anesthesiologist, and surgeon, as well as any pertinent specialist to highlight all of the things that we talk about during your appointment. Please feel free to give us a call with any questions or concerns. We are always here for you and will be glad to help.
Thank you for choosing Lima Memorial for all your surgical needs. This is your surgery and your outcome. Let us show you how to get the best result.